Etymology of the ear. So this will be a revision PowerPoint for you guys, but hopefully this will make the topic a bit more clinically relevant, so it'll be useful information for our future studies. I'm going to go back over some of the basic anatomy of the ear that we covered last term, give you an introduction into examining the ear, and also give you some examples of either common or interesting ear pathology. So, anatomy of the ear. Hopefully, using etymology, it will help you understand where some of the names of these various anatomical structures come from, and it will make it easier to remember their location, appearance, or function. For example, did you know that the word temporal bone, as you can see in this image here, comes from the Latin word temporalis, which means time. The thinking behind this is that the temporal bone is situated on the sides of our skulls, where grey hairs are often first noticed. Therefore, this area shows the passage of time. So, the ear can be divided into the outer ear, middle ear, and inner ear. The outer ear includes the pinna, derived from the Latin word penna, which means feather, wing, or fin. The outer ear also includes the external acoustic meatus. Acoustic means pertaining to hearing. A meatus is the Latin word for passage, derived from the word mere, meaning to flow or run. Therefore, the term acoustic meatus literally means hearing passage. It can also be called the auditory canal, or simply canal. The tympanum, or tympanic membrane, is a thin circular layer of tissue that divides the external acoustic meatus from the middle ear. In layman terms, it is referred to as the eardrum and is derived from the Latin word for drum. This relates to how the tympanum vibrates as a sound wave hits it, like the skin on top of a drum when hit. As we move into the middle ear, we come across three little bones called the ossicles. Ossicles means little bones. They are three interconnected bones that sit between the tympanic membrane and the internal ear. The three bones are movable and vibrate with the tympanic membrane, transmitting sound to the oval window of the cochlea. The names of the ossicles refer to their shapes. We have the malleus, meaning hammer, incus, meaning anvil, and stapes, which means stirrup. The malleus is attached to the tympanic membrane, and the base of the stapes is attached to the oval window of the ear. Vibration of the tympanic membrane pushes against the hammer here, which pushes against the anvil, which pushes against the stirrup. These bones are tiny, with the stapes being the smallest bone in the human body. Without the ossicles, however, we would not be able to hear properly. The inner ear is made up of bony cavities, collectively called the bony labyrinth. The word labyrinth originates from the Latin word for maze, and you may have come across a number of these words when referring to the auditory system, such as labyrinthitis and the labyrinthine artery. The bony labyrinth includes the vestibule, meaning entrance. This is where the vibration of the sound wave first reaches after being transmitted along the ossicles. Attached to the vestibule are the semicircular canals, which play a role in balance, and the cochlea, known as the organ of hearing and called after its appearance, which is that of a snail shell. The cochlea contains hair cells which convert the sound waves into nerve impulses, which are then carried to the brain. And finally, I will mention the eustachian tube, named after Bartolomeo Eustachi, an Italian anatomist. It can also be called the pharyngotympanic tube, and I will use these terms interchangeably. So, the tube links the nasopharynx to the middle ear, hence its name, pharyngotympanic. It equalises the pressure on either side of the tympanic membrane, so the pressure in the middle ear is the same as the pressure outside. It also drains fluid from the ear. The majority of the time, the tube is closed and only opens when we yawn, swallow, or blow our nose. The eustachian tube can become blocked due to infection or inflammation, leading to pain and hearing difficulties. In young children, the eustachian tube is more horizontal, less rigid and narrower, compared to adults and older children. Therefore, it is thought this could increase the likelihood of the tube becoming blocked and be part of the reason young infants are prone to getting ear infections. Alternatively, in rare cases, the tube may stay open most of the time, resulting in autophony. This is when the patient can hear their own voice or breathing. The patient may also have a sensation of fullness in their ear. We call this patulous eustachian tube. The word patulous originating from Latin and meaning to be or to lie open, an open eustachian tube. So, examining the ear. Doctors will use an otoscope to look at the ear. When examining the patient, you want to be seated at the same level and you want to be able to access both ears. You want to start with the patient's good or better hearing ear. If there is an infection, this can minimise the risk of transferring it to the good ear. You initially examine the external ear, noting skin colour and looking for deformities, inflammation and scars in front of, so here or behind the ear if you pull the pinner forward. As you can see from the image, there are a variety of landmarks to notice on the pinner with interesting names, but I won't cover these today due to time. You can then use the otoscope to examine the ear. Pulling the pinner upwards, outwards and backwards straightens the external auditory meatus and will allow you to observe the tympanic membrane down the otoscope. You should inspect the canal for wax, discharge, foreign bodies and other abnormalities. Then you can examine the tympanic membrane. When examining the tympanic membrane, you want to identify the manubrium or handle of the malleus, which is attached to the tympanic membrane as we discussed before. You can also identify the cone of light or light reflex in the anterior inferior quadrant caused by the reflection of light from the otoscope. When there is fluid in the middle ear, the tympanic membrane will often appear dull and the light reflex may be lost or in a different place. You can also note the pars tensor, which is this area, and as the name suggests, is the tense section of the tympanic membrane, and the pars flaccida, which is the smaller flaccid portion at the top here. Now I will briefly cover some ear pathologies. So acute otitis media, as the name suggests, is an infection or inflammation in the middle ear and is very common, especially in young children. You can also get otitis externa, which is inflammation of the external auditory meatus and is also known as swimmer's ear. Otitis media with effusion, also known as glue ear, is when there is a collection of fluid within the middle ear, but without symptoms of an acute ear infection. This collection of fluid normally precedes or follows an ear infection. In the top diagram here, it shows the middle ear space filled with mucus or liquid, otitis media with effusion. In the bottom picture, depicting acute otitis media, the middle ear space contains pus due to an infection. In acute otitis media, the tympanic membrane often bulges outwards due to pressure buildup, as you can see here, and you'd be able to see this down the otoscope. Otosclerosis is a condition where you get abnormal bone growth within the middle ear, and in the majority of cases is due to immobilization of the stapes. Therefore, the ossicles cannot vibrate normally and are unable to effectively transmit the signal to the inner ear, resulting in conductive hearing loss. However, this is more of a misnomer, which means mistaken naming, when it comes to etymology. It is often better described as otospongiosis, at least in the earlier, active stages of the disease. This is because the lesions that form are made of spongy bone that welds the stapes to the surrounding bone, immobilizing it, instead of otosclerosis, which indicates there's bone hardening, or ear hardening. Symptoms include gradual worsening of hearing, tinnitus, and sometimes even dizziness. Interestingly, unlike many other common types of hearing loss, patients with otosclerosis often find it easier to hear when there is background noise around. And lastly, I'm going to tell you about a condition known as surface ear, or medically as exostosis of the external ear canal. To better understand this condition, let's look at the word exostosis. Exo means out, and stosis comes from the Greek word osteon, meaning bone. This condition involves a bony outgrowth in the external ear canal. Looking down the acoustic meatus with an otoscope of someone with this condition, you may see something like this. In severe cases, you may not even be able to visualize the tympanic membrane. Exostosis is the most common tumour of the ear canal. This condition occurs in people who are exposed to cold water or cold wind over a long period of time, hence the name surfer's ear, and is seen in swimmers, surfers and kite surfers, etc. Evidence suggests the pathophysiology of this condition occurs as a result of vasodilation after exposure to cold water or wind. The increased blood supply leads to new bone formation. Patients present with hearing loss, but may also have symptoms of infection, pain, and tinnitus, particularly when the bone growth is large enough to cause cerumen, or earwax, to you and me, to build up. So thank you, that's the end. Thank you very much for listening. I hope this was a helpful revision of the year from last term, and hopefully I've given you some more information that will be helpful in clinical years to come.